Hi, welcome to our Simsbury. I'm Althea Graney, your host for today's discussion, Latest Advances in Dental Technology. Our guest is Dr. Greg Farber. Hi Greg, welcome to the show.
Thank you very much. It's great to be here.
First we'd like to get to know a little bit about you. And we were just talking about that you actually went to school here in Simsbury.
I did. I'm a graduate of Simsbury High School and also of the public education system here in Simsbury.
Great.
From Latimer Lane Elementary School to Henry James Memorial to the Central School, which some people may remember, and then Simsbury High.
Simsbury High, wonderful. So you're a product of Simsbury education plus a college degree in dentistry.
Graduated from the University of Connecticut out in Stores and from the University of Connecticut Dental School in Farmington at the Health Center.
Wonderful. So you are very familiar with Connecticut.
I'm a little bit familiar with Connecticut, a little bit familiar with the Farmington Valley, and it's a wonderful place to have grown up, and I'm happy to still be here.
Wonderful. We're happy that you are still here.
Thank you.
So how long have you been a dentist? You graduated from the dental school in?
About 14 years ago,
Wow.
I graduated, so it's been quite a while. I did some postgraduate work down in New Haven, and found my way through a few different practices, and now I'm practicing in Windsor on Day Hill Road.
Oh, great. Yeah, I know where that is. So when you first started your practice, what were the most critical problems facing your patients at that time, 14 years ago?
Interesting. They really haven't changed too much. One of the biggest problems that we found back then and now is still cavities, particularly in children. Although the rates have changed a little bit, they haven't fluctuated to such a great degree where it would really change dramatically what we're doing. We still find a decent cavity rate amongst our children.
Wow.
And despite all the efforts with fluoridation of the water, education at home, in the dental office, and in the school systems, we still find there's a decent amount. Of course, we always think there's too much, but a decent amount of cavities amongst our children.
Oh, that's real unusual. I mean, is a lot of that due to just the makeup of the teeth, or is it just a combination of diet and dental hygiene?
There are a lot of factors. You hit on two of them right there. One is diet, probably one of the most important factors.
Right.
Cavities need several things to form. They need sugar, and they need bacteria on the teeth. Eliminating sometimes even just one of those factors will dramatically cut down on the cavity rate. Of course, cutting down on the sugar intake is critical.
Right.
Of course, good oral hygiene with good brushing and flossing is critical also to remove the bacteria that settle on the teeth.
Okay. So it's not a matter of you're just born with extra strong teeth. It's a matter that you ate correctly and properly took care of your teeth.
Generally speaking, taking care of the teeth through good brushing and flossing and cutting down the sugar will help most people. There are some really lucky people out there who, through genetics, seem to have a very low cavity rate. Lots of different reasons for that, but there seems to be a certain population that is somehow resistant to cavity formation, despite how much sugar they eat.
Okay, yep. Yeah, because I only got mine when I was eating tons of lollipops. After I cut them out, I'm good.
A good point, actually, because sometimes people don't realize the type of sugar intake that's happening is critical. For example, a real sticky or chewy type of candy, such as a bit of honey or a sugar daddy, can stick to the tooth for a lot longer.
Yep.
That sugar eventually breaks down into acids, which cause the cavities. That's a little bit different than having something sweet to drink and then rinsing your mouth with water where the sugar will not settle on the teeth for too long. So the type of sugar intake that you have is important too.
Okay. Have the remedies changed?
They have.
Really?
They certainly have. Most dentistry today, conventional dentistry, does involve numbing the teeth, using a handpiece, some people call it a dental drill, using the handpiece to remove the decayed part of the tooth and place a filling. That still is the mainstay of dentistry today.
Okay.
However, if a cavity is caught early enough where it hasn't penetrated too deeply into the tooth, we can use something called air abrasion to remove the decay.
Oh.
What that involves is using a pen-like wand hooked up to a little compressor where it sprays out some air and fine sand particles, very abrasive but minute in size sand particles, to abrade away the decay. This is usually done without any anesthesia. It's usually done completely comfortably, and oftentimes we use it for children. We use it a lot for adults also. And one of the photos that you can see on the screen right now shows the actual pen-like wand that I use to remove these shallow, or what a lot of dentists call incipient, cavities.
Okay, they're not really, they've not really gotten to the heart of the tooth.
They haven't gotten to the inside, all the way to the inside of the tooth. Sometimes, though, we can use that even though a cavity has gone into the inside of the tooth a little bit. The beauty of this technique is, again, it's relatively quick and simple to use. Typically, no anesthesia is required, so you don't walk away with a numb mouth afterwards.
Drooling out the side.
That kind of thing. And it's tolerated very, very well by patients, to the point where a lot of children oftentimes will use this for children to treat their cavities. Typically afterwards, a white tooth-colored bonded filling is placed. It's cured, it's adjusted and polished, and that's really it. It's a little bit different than the conventional getting the tooth numb, taking out a handpiece and cleaning the cavity out that way.
Wonderful. Sounds great, but I'm not going to get a cavity just so I can try it. So have things changed with the way you diagnose problems, dental problems now? Or is that still sticking those big, ugly, horrible, uncomfortable things in your mouth, biting down, they adjust the x-ray and the technician runs out of the room?
That's something that has changed very dramatically, and thanks to the advent of a lot of technological and specifically computer-assisted technologies, has really changed the way that we diagnose what we do. Specifically, just as you mentioned, the taking of dental x-rays. In this day and age, many offices, including ours, use what's called digital radiography. What does that mean? An x-ray is taken using, instead of a film, a small sensor, as you can see on the screen there. It's very small and comfortable to use. It's placed similar to how a conventional x-ray would be placed. The x-ray is exposed, and the image of the tooth instantly appears on the computer screen, typically right in the office, right in the operatory. Oftentimes, patients tell us that this is certainly more comfortable to do because the sensor, as it's called, is only in your mouth for a brief second. But what a lot of patients like is the fact that this type of digital radiography uses about 90% less radiation than your conventional type of x-ray. So it's really a great, great stride as far as x-rays, so-called x-rays go. The fact that we can do this comfortably, quickly, very comfortable for the patient, and uses much less radiation. Yeah. I mean that getting the X-rays every 2 years, right? Every other year? Depends on the patient. Typically once every year. Some patients, depending on their dental problems, need X-rays taken every 3 years. Some every 5 years. All right. So just cutting back on that radiation would just be wonderful, because the exposure over time seems to... The advent of digital radiography has really changed the way that we practice, so we don't have to wait 5 or 10 minutes for the x-rays to develop. We can take an x-ray, immediately diagnose the problem. The patient can see on the computer screen that we have in our operatory exactly what the issues are. Many of our patients even request that we email the dental x-ray image to them, and of course we can email it to the insurance companies and get a quicker return. Hey, another benefit. So, a very good benefit. So, well, and I imagine being able to diagnose it more quickly, are you then able to perform the, any corrective procedures, especially like that air thing? Well, we can, generally speaking, manipulate the image so that you can see more clearly, in my opinion, more clearly. And you can also see different things on the x-ray. For example, a cavity may show up a little differently on this type of digital x-ray sensor. But you can manipulate the image so that other problems, which sometimes are difficult to see on a conventional x-ray, can easily be read on the digital image. So that's another benefit.
And then you just reschedule to get that corrected. If it
You can
needs
reschedule, or if time permits, take care of the problem right then and there. The other beautiful thing about it is once you have that image stored, it's in your computer, it's in there for forever. X-ray film has to be stored in a chart, transferred, mailed back from sometimes provider to provider. Sometimes, I hate to say it, but X-rays get lost every now and then in the mail. And
and they're not
kind
the
of
most durable material either. I imagine they must also get folded, bent, ripped. And
all those things can happen.
Yeah, super. So yeah, and then also could you compare? Then you could compare one X-ray to another X-ray without actually holding up and doing a physical. You could actually have the computer overlay and say, this is what's changed over time.
Oftentimes, what we'll do is take an X-ray taken 2 or 3 years ago, put it on the computer monitor, and put it side by side with one that was taken today, for example, and you can clearly see the differences between the two. It's a wonderful feature to have. We've been using it for a few years now, and it's really changed the way that we practice.
Wow. And was there a large learning curve for your staff to go from the old way to the new way?
There was a little bit, not too bad. What we really had issues with was more our office getting used to how the computer software interpreted the images, because we were used to looking at X-ray films. Now we're used to looking at a 13-inch or so, or one of our computer monitors is 22 inches, wide. Getting, use that image is a little bit different. But for sure, it's a step in the right direction. It's a big step, big improvement in the way that we practice.
Great, great. The dental materials, they've changed also. You mentioned the white composite. I know I've got silver fillings, and I think I have one white composite, but this is from ages ago. So I'd imagine they've changed even since then.
The majority of the fillings that we place today are the white tooth-colored composite type fillings. We still do place some amalgam fillings when needed, when appropriate.
When would that be?
Sometimes if a cavity has extended under the gum tissue, and we are unable to keep that working area completely dry, it's important that you consider which materials are going to work the best and last the longest. Generally speaking, composite materials need to be placed in a dry working environment. If we're unable to obtain that, sometimes a silver filling is better. One of the other materials that has come out in the past few years involves the use of a zirconia type material.
What's zirconia?
Zirconia is a white material used as a substructure to crowns and bridges. In the past, as you can see on the screen also, we've used porcelain fused to metal type crowns. These are wonderful materials to work with. They still do great. Even the majority of the crowns we place today have porcelain on the outside, baked onto a metal substructure for strength on the inside. These are still widely used today. They do a fine job. However, in the aesthetic areas where patients are concerned about any metal showing, where it can be unsightly, or some patients, rarely, but some patients do have an allergic reaction to the metal that's placed, we can use this zirconia as a base, which is light colored, tooth colored. You can also place porcelain and literally bake or fuse the porcelain onto the zirconia, so that instead of having metal on the inside, you'll have a white tooth-colored material on the inside. These materials are incredibly strong. They work very, very well, and we've been using them for a few years now, and we've had wonderful success with them.
Wonderful. Well, it would be nice, because I would imagine that if you had needed a crown in the front, and you had that dark metal inside, it might make the tooth look a little dark.
Right. One of the indications for the use of a zirconia or porcelain fused or zirconia crown is in what we call the aesthetic zone, top front teeth, the lower front teeth. Again, these materials are incredibly strong. They withstand bite forces very well, and when used appropriately, they can last for years and years and years, just as long as a porcelain fused to metal crown would last.
Wonderful. Can they be used to totally? Can that zirconium be used to totally replace teeth? Like I know my mom has bridges and things like that. Is that something that's...
Zirconium can be used as a substructure for a relatively short span bridge. However, they can also be used as single unit crowns. They can be used, again, for the short span bridges. recently, in the past 5 or 10 years or so, they've also been used in part to replace missing teeth. For example, patients who have dental implants to replace their missing teeth can have a zirconia crown placed over the abutment of their implant. The abutment, or the attachment from the crown to the implant itself, can oftentimes be made of zirconia.
Okay.
So that anything above the gum tissue where you would see this abutment doesn't have to be metal. You can have it all zirconia and then place a porcelain fused or zirconia crown over it. That's probably the ultimate in aesthetics as far as dental implants are concerned. Placing in a zirconia abutment with a porcelain fused or zirconia crown on top of it.
Wow. It's amazing. Can make everybody look brand new.
It's really, things have really come a long way as far as replacing missing teeth like that. Also, the materials that we use are not only strong and efficient, but they're very, I'll use the term biocompatible. They're very kind to the gum tissues.
Good.
They don't cause reactions to the gum tissues in the mouth or even systemically. They've been very well received.
Good. Yeah, well, that was one of my questions. Was I know that a person who has a problem with metals, and so this zirconium would be the perfect alternative for that person. Would
be a very good choice for that person.
Excellent. So, are there new medications out in the dental field, or is this still, if you need to do Novocaine, it's still Novocaine? And
typically, the quote-unquote Novocaine hasn't changed too much. There are one or two new, I'll call it a variation on the a new variation on the old, which involves a shorter acting Novocaine, so that you don't have to be numb for so long. This has been, again, very well received in the dental community.
Yeah.
Many dentists use it now, and gets people just as numb as they otherwise would be, so they're comfortable during any dental treatment.
Right.
But they don't have the lingering after effects of the numb lip or tongue for so long.
Okay, that's a good thing, and it works just as quickly to get them to that point where they need the procedure done. So
it works just as quickly. Some people say, dentists of course will say it works, even quicker. However, those scientific studies try and break down amongst seconds.
Right.
Does it take 10 seconds, 20 seconds? Generally speaking, it acts fairly quickly.
Okay. Fluoride is still basically just fluoride, right?
Yeah, fluoride has has shown a great reduction in the amount of cavities that form amongst our children. Although, as we mentioned before, we would, of course, love to have a zero cavity rate amongst our children, but it's greatly helped children and adults now.
Okay.
Partly because not only can you place fluoride in the drinking water and have a systemic effect, but topically it placed fluoride. In other words, fluoride placed directly onto the tooth has really helped cut cavity rates not only amongst our children, but in adults too.
Right.
One of the biggest problems with that we see in our population that's aging and the amount of gum recession that we see, and therefore exposure of the roots of the tooth, allows for more cavities to form on those roots of the teeth.
Okay.
And as a result, one of the defenses we have to try and combat the rate of cavity formation on the roots of teeth is to apply these fluoride varnishes, as we call them. Also, patients can apply them at home and dramatically cut down on the rate of cavities forming.
Okay. Now, my daughter was having her teeth, I don't think it was bonded, but she had some sort of a layer of something put on her teeth to keep the sugars and stuff from hitting them.
Sure.
What was that?
That's called a dental sealant.
That's it.
It's a great preventative technique, usually applied to children's teeth, or I should say to children, but with their adult first molars.
Okay.
These are some of the most cavity-prone teeth in the mouth. And what we like to do is literally seal out the sugar and or bacteria that would otherwise form on the teeth and cause cavities to develop.
Okay.
These sealants are easily placed, very comfortably. It takes a minute or two to place per tooth in the chair without any anesthesia, certainly at all.
Right.
And they last for years and years. They're literally one of our best defenses against forming cavities on the biting surfaces of the adult first molars.
Okay, and those are way, way back here.
Those are way in the back, and they typically erupt or come through the gum tissue around age 6.
Yep.
So a lot of people call these the 6-year molars.
Okay.
But dental sealants are great way, preventative way of treating these teeth. Cut down on the cavity rate that way. Very well tolerated by the children.
Yep.
Every once in a while they need to be replaced.
Okay.
But generally speaking, a effective, quick, easy, and I use the word effective, I should use cost-effective way to prevent cavities from forming.
Okay. We didn't touch too much on the maturing adults problems. We did a little bit. We did the receding gum lines, which exposes the tooth roots, and yeah, I know I got that little thing going on here, but is there any way of preventing that receding gum problem, or at least slowing it down?
There is one main way of preventing it, and that, first let me talk about the reason why that happens.
Okay.
Oftentimes that happens because of over-aggressive toothbrushing in the first place.
Okay.
So when patients visit their dentist, it's important that the dentist or dental hygienist, should that be the case, go over the brushing technique that they use so that the patient isn't damaging the gum tissue and causing this recession to occur. The majority of cases that we see where there's a lot of gum recession, that is the problem, over-aggressive toothbrushing or brushing with an incorrect technique. Patients need to be aware of, or they should be using a soft toothbrush, and they should also be using the correct brushing technique. That's one issue, one cause of receding gums. Another is, of course, periodontal disease. Many people have heard of this. That is a chronic bacterial infection of the bone that supports the teeth and gums. And if periodontal disease gets to a certain point where enough bone is lost, for sure the gums will recede on top. This is one of the first signs of periodontal disease in adults, is a little bit of gum recession here and there. But it also needs to be monitored, and it needs to be managed appropriately by the dentist or the dental hygienist.
All right, good. So stop brushing my teeth so hard. Okay.
Brush gently, but brush often is what I'll say quite a bit.
Okay.
You don't have to give yourself a workout by brushing your teeth.
But I like them to shine. Okay. And lately, I've been reading a lot about how dentists are our first line of defense against oral cancer. Could you just kind of enlighten our viewers about that a little bit?
Oral cancer has gotten a lot of press lately, which is good because it is something that needs to come to the forefront a little bit, so people are more aware that oral cancer, if detected early, can oftentimes be treated effectively. However, it's still disappointing to see sometimes that patients who don't go to the dentist as often as they should,
which is
typically every 6 months, sometimes for the majority of patients, even every 4 months for routine cleanings and checkups.
Okay, for some. Okay.
However, oral cancer can best be detected, as I always say, excuse me, by a sharp set of eyes, by the dentist or hygienist, and using a good tactile technique to feel the tissues, cheek tissues, tongue, what we call the oral pharynx also. Make sure these areas have no suspicious signs of anything growing that shouldn't be there.
Okay. Yeah. So, yeah, because it can be a little scary for somebody. Like, I had a moment where I had something on the roof of my mouth, and I was just scared out of my mind. I was like, what is this? And, you know, I called my dentist, but he wasn't in that particular day. And I ran to my doctor, just, what is this? It ended up going away, but it was very frightening when you just discover that you have this this lump, and you've heard so much about oral cancer.
Right. Lately there have been some newer visualization aids, I'll call them, to help us see these lesions, I'll call them, earlier on.
Yep.
It involves sometimes swishing your mouth with a special rinse, shining a special light inside so you can see these suspicious areas, which kind of will appear a little bit different than the normal tissues. These have gotten somewhat popular, but they do an effective job at what they're advertised to do. They do help you detect things a little bit better, but again, I still say a sharp set of eyes and a good history, specifically if a patient's a smoker, or if they have a family history of cancer, specifically oral cancer, they need to tell these things to the dentist.
Okay. The dentist needs to be informed. Because you're trained. You're trained as a doctor first and a dentist second, right? Something like that? Or
some people call us the physicians of the mouth.
Okay.
However, I still think that good set of eyes, training in how to do a good oral cancer exam, which should only take a minute or two, and a decent set of x-rays, should be able to determine whether or not oral cancer is present or not.
Excellent. So any advice for, this is kind of like winding down, for people how to prepare their child for their first dental visit?
Great question. We always ask parents to bring their child, usually around age 2, 2.5, to their visit with them, so the child can get used to the sights and the sounds of what a dental office is all about. That way it takes some of the unknown out of the child's mind, so they can kind of see already what goes on there, maybe meet the dentist or dental hygienist who's going to be treating them.
And they get to see mom and dad go through it and not get all panicky. And
usually that takes a lot of the unknown and uncertainty out of the child's first visit, which contributes a bit to their fears.
Great, great. Well, I want to thank you, Dr. Greg Farber, for joining us today. It's been great talking with you. Really loved it, and it was very educational and informative.
Well, thank you very much. Glad to be back.
Thanks. So I'd also like to thank our volunteer camera people, Mitzi Payne and Gordon Rutherford, our producer and director, Buzz Holmes, our station manager, Karen Hanville, our production designer, Timothy Griggs, operations assistant, Phyllis Fishberg. Keep smiling. People will wonder what you've been up to. My name is Althea Graney. Thank you for watching our Simsbury.
As parents, we do whatever is necessary to ensure the health of our children. Sadly, most parents don't realize that their child's first eye exam with an eye doctor should be between the age of 6 and 12 months. I urge you to take your baby to an optometrist for a comprehensive eye assessment. It can literally change your child's vision of the future.
Infancy optometrists offer a no-charge eye assessment for infants 12 months old or younger. Call today to find an optometrist near you.
Congratulations on the promotion.
I hope you're saving the extra money.
You gotta put it in stocks.
If you want to get ahead.
No, buns.
And CDs.
Way to go. Get it balanced.
Stick it under the mattress.
Getting plenty of advice, but not enough facts? Visit SaveAndInvest.org. No confusing advice, no sales pitch. Just unbiased information and tools to help you manage your money with confidence. SaveAndInvest.org.
What will you do when you hear your calling? Will you ignore it? Or will you listen? Peace Corps, life is calling. How far will you go?
Salam.
Jam.
Salam. Hey, what?
Reader. Apa pa? Pa.
Mir. Shanti. Yep, Changyok.
We all want the same thing.
Peace.
And Rotary clubs are making it happen. Through international scholarships for young people to promote peace and understanding around the world. Rotary. Humanity in motion.